Well, good morning. My name is Warren Limmer. I'm state senator and also chairman of the Judiciary Committee here in the Minnesota Senate. I want to thank you for showing up this morning at 8:30 on a Monday morning. I'm honored to welcome Congresswoman Michelle Bachmann back to the state capitol. As many people know, Congressman Bachmann, as well as a number of legislators, are very concerned about where the state is going in reference to the early MA enrollment that the governor has just recently signed us up to. There was questions, as you know, about the constitutionality of such a movement by this governor. And then, despite that, he even quickly revved up the timetable for early enrollment. We had thought that perhaps August or September was going to be the day or the month that MA would be early enrolled into that portion of Obamacare. That has been moved up to March 1st by an executive order by the governor. Now, you may recall we had a press conference here about a week and a half ago about a letter that I had sent to the governor about the constitutionality concerns that we've had with the early authority given to him by the past legislature. Many of us believe that's unconstitutional. You cannot commit a future legislator on the actions of the last legislature. And despite that, even if the governor did sign an early enrollment in MA, that triggers present-day budgets that need to be passed not by the executive branch, but by the Minnesota legislature. The legislature has the power of the purse in this state, and the governor does not, despite any authority that he thinks he may have. I'm going to pause at this time. I'm going to introduce Michelle Bachmann to you, and then we'll hold for questions, and other legislators also have some opportunity, or give them an opportunity if they wish to speak as well. Congresswoman Bachmann.
Thank you. Thank you, Senator Limmer, and thank you all for coming this morning. There's an old phrase that says, when you're in a deep financial hole, stop digging. And as you know, Minnesota is in a $6 billion financial hole right now. And unfortunately, our new governor, Mark Dayton, who is a good man, he is not we're not here to say that he's a bad individual. We just simply think that he's wrong about his prescription for where Minnesota needs to go. Made a statement that I thought was fairly remarkable last week. He made a statement in the paper by saying, repeal of Obamacare would be catastrophic for the citizens of our state. He went on to say that he is seeking to expand Medicaid for an additional 95,000 Minnesotans and extend the deadline to apply for a $1 million health exchange grant, which our Health and Human Services Secretary suggested is in the works. Well, this is an extraordinary statement. The governor, in one of his very first acts as governor, when the state is in a $6 billion hole, seeks to put an additional 95,000 people in this state on the welfare system at a time when we're constrained to support those who are already on the system. And if he is doing it for the reason of applying for an additional $1 million grant, if you do the math, that means that each one of these recipients would be receiving about $10, a little bit more than $10. That wouldn't even pay for a morning's worth of health care for those 95,000 additional people on Medicare. This is an extraordinary move on the part of our new governor to have this be his opening signature statement to seek to add almost 100,000 new people to Minnesota's already overburdened welfare rolls. And so the reason that I'm here this morning with my colleagues from the Minnesota State Legislature is to call on Governor Dayton to heed his own advice. Because last week, when these same lawmakers put out plans to reduce spending and to reduce the size of government here in Minnesota, as they wisely needed to do, Governor Dayton said that he wished that they would take their time. He also said the matter was marked by complexity and needed more time for talk. And this is the same governor who on the third day of office signed the executive order that expands Medicaid, Medi-Cal assistance, ensnaring the state in Obamacare, and will cost us millions upon millions of additional dollars that we don't have in Minnesota. All across the country, we're seeing Obamacare is driving up health care costs. Insurance premiums are rising. Bureaucrats are starting a process that will expand the list of minimum benefits insurance companies must offer, and that will raise the price of health insurance, and worse, it will take away consumer choice here in this state. Small businesses are fearing that these mandates and penalties of Obamacare will drive up their expenses. We're already seeing that happen with private insurance premiums, or make it impossible for small business owners to provide health coverage for workers, forcing them ultimately into government-run health care. I saw that when I did a tour of small restaurant owners who were busy trying to cull their rolls so they would have fewer than 50 employees on their employment records. Last week in Washington, our House of Representatives took a bipartisan vote to repeal Obamacare. At the same time, more than half the states in our country, 27, Iowa being the latest, are suing the federal government over the constitutionality of Obamacare. Very serious steps are being taken to stop this job-destroying legislation that will cause health care costs to rise exponentially. Yet here in this state, our governor, Governor Dayton, is unyielding in his desire to fully commit our state to it. In fact, he's wanting to make an already very difficult problem worse in this state by adding even more people to the welfare rolls. We're here this morning to call on Governor Dayton to change course. If Governor Dayton truly believes that cutting spending and shrinking the size of the government are complex issues, then how can he not at least withdraw his executive order? And that's what we're here to do this morning. We're calling on Governor Dayton to withdraw his executive order, sit down with these lawmakers who are only too willing to discuss with Governor Dayton what we can do to work this issue out, and work on the kind of bipartisan health care solution that will not add to our state's $6 billion deficit. Obamacare is already raising insurance premiums. It will raise taxes. It will raise taxes for people in Minnesota. It will gut the Medicare Advantage program, which many people in Minnesota take advantage of, and it will rob the people of our state of the choice to buy the kind of health insurance that is best for them and for their families. The time has come to fully repeal Obamacare, and we may need to take extraordinary actions together in order to see this happen in the next 2 years. And I yield back to Senator